We are about to have a current, and I do mean current, conversation about COVID-19. And our guest is Dr. Amy Beth Kressel. Dr. Kressel is the Medical Director of Infection Prevention and Antimicrobial Stewardship at Eskenazi Health. Dr. Kressel, welcome, and thank you for joining us.
Thank you for having me.
And you know, I stress the word in the title, a current conversation about COVID-19. I stress the word current because this virus is ever changing. So when I say current, we're talking about within the last, week, maybe 2 weeks of information. So thank you again for being here. So I guess to start out with the current nature of what we're going to talk, what is the current picture in terms of vaccination rates and rate of infection here in Indianapolis and Marion County?
So right now, there's still quite a bit of infection going on. It is not as high as it was in September. It's not as high as it was last winter, but it's by no means normal. It seems to have dropped a bit, and now it seems to be holding steady. So not dropping, not rising. We'll have to see what it does. People are still being hospitalized and still dying. I think we've gotten so used to it that we forget that this is not normal for us to have this many hospitalizations. Our hospitals are still pretty busy, even with this slight drop in the numbers. So we're just hanging on here. You asked about vaccines too. Roughly a little more than half of the eligible people in Marion County are vaccinated. And as you know, vaccine was just opened up to children between ages of 5 and 11.
Yeah, ages 5 and 11. So looking forward in terms of the vaccination as well, but the rate of infection, are we expecting another surge as we tend to get inside and stay inside a lot more with winter just right around the corner?
So I think anybody who tries to make predictions is going to be proven wrong at some point. So I hesitate. I'm concerned that the cases are not still dropping, that they've kind of leveled off and it is getting colder and people are coming inside. I was hoping that, although I think we will have another surge, I'm hoping that it won't be quite as bad as this last one that happened over the fall. I do think eventually enough people will be vaccinated or enough people infected that we will have smaller and smaller surges. Historically, the 1918 influenza pandemic, it lasted 2 years. I don't want to make more concrete predictions because I know I'm going to be wrong.
The 1918, the one that's often referred to as the Spanish flu, correct?
Correct.
Yeah. An area of particular concern since the beginning in terms of when vaccinations were available has been the low rate of vaccination in the African American community. Bring us up to date and give us what the current numbers are there. And, I'll ask you another question probably after that. But where are we there in terms of vaccination rates among African Americans?
I think African Americans are starting to catch up. And I think there are concerns about access and trust in the system. Unfortunately, the African American community has been harder hit with COVID for a number of reasons. Partly, because people who have jobs that require them to go to work and not work at home are going to be more vulnerable. Partly because of access issues to vaccine, partly because of socioeconomic disparities. Chronic conditions that put you at higher risk of severe COVID are more common in the African American community. So just a number of things going on. I think that vaccination rates are starting to even out.
As a demographic group, are African Americans still the least vaccinated and the most hospitalized with serious disease and the most dying from COVID?
Mostly. I mean, there are other socioeconomic groups that are also really hard hit, like Native Americans, for example.
Yeah. So what the rate, the last time we spoke with someone about this. The numbers that I was given was 35% of African Americans in this county alone, only 35% were vaccinated, which lagged behind all groups. Is that still about right, or has that changed?
I don't, Tina, I'm so sorry. I don't have the exact number broken down by race. So I apologize.
Oh, no, that's okay. That's okay. But it's, as you were saying, and as I was told when I got that number had increased slightly from 25%, which was better. And it kind of coincides with what you were saying a few moments ago, that, the African American community is slowly catching up, but we still have a ways to go.
That is correct.
Yeah. And so what do you think, doctor, is gonna build trust in this vaccine in communities, not only African American, but other minority communities that have such a high rate of vaccine hesitancy?
Right. I wish I had the magic bullet to that. I know, there have been many prominent leaders from the African American community who have publicly gotten vaccines, including Dr. Hildreth, who is the president of Meharry Medical College, who also served on the FDA, has been serving on the FDA advisory committee for that's advising FDA on these vaccines, and who has voted in favor of all of these vaccines, as well as receiving them himself. I think, I look actually toward the African American community's leaders to publicly get vaccines, as they have been. And I just hope that other people in the community listen. It's hard for me to answer that, right? Because I'm not a member of the community. I will say I have my sticker on.
What's your sticker say?
My sticker says that I received my COVID-19 vaccine at Eskenazi.
There's a thing you can put on your, I've seen people use it on their Facebook profile pictures. You can do things like that. So anyway, you've been vaccinated. Go ahead. I'm sorry.
Vaccinated. I got my booster. All my family's vaccinated. My children are vaccinated. I tell everybody to get vaccinated. So I myself have confidence in the vaccine and have gotten myself vaccinated. I hope that has some weight there.
What do you have to say about not just African Americans, but everybody in general that has this vaccine hesitancy? And one of the most common reasons that they give is that it came to market way too fast. I don't trust it. It came too fast. How do you address that, and how can you debunk that? I guess it's a rapidly growing myth, because once you learn, that's not the case.
Right. So the vaccines did come to market very rapidly for a number of reasons, both good and bad. The good reason is that the federal government spent a lot of money helping the companies do this. Another good reason is they used technology that has been developed in the past for other things, like the mRNA vaccines. Though these are the first mRNA vaccines to actually be used, this technology has been worked on and developed and was waiting for an opportunity to be used. I mean, it's not something that was invented just for this pandemic. So the mRNA vaccine is a way to take a newly identified virus that was sequenced because of advances in biomedical engineering and genetic sequencing that have taken place over decades. That technology was taken to take this new virus, to sequence it, give that information to the drug companies. They took this mRNA technology and other technology that's been developed for other things. The Johnson & Johnson vaccine is using the same technology that was used for the Ebola vaccine. So it's kind of plug and play a little bit. So all that technology was waiting. The bad reason you got approval so quickly is that COVID was so overwhelming and so common in the United States in 2020 that when they did the studies, when they had some people who got the vaccine and others who didn't, there was so much COVID around that the people who didn't get vaccine very quickly had a lot of infections. So it was very quickly clear that the vaccine worked and protected people, because the people who got vaccine did not get those infections. If there had been less COVID around, if it had been less common, it would have taken a lot longer to prove the vaccine worked. So that it was a number of reasons that vaccine could be approved so quickly, or not approved, authorized.
Yeah, authorized. And so it's kind of a little misleading when you hear came to market quickly, because that's not the story. The story that the I guess what you're saying is the components were already in place, and with a little extra money and urgency or what have you, these components could be brought a lot quicker than they normally would have been had they just stayed in development. Not necessarily that they are bad because they're fast.
And unfortunately, there was so much COVID raging that, again, once the clinical trial started, it very quickly became evident that the vaccine protected people, and it protected people safely.
On a scale of 1 to 10, how safe would you say these vaccines are?
I would say 10. Now we have millions of people vaccinated in the United States and worldwide. The side effects are very rare. And it's actually remarkable that we can even detect some of these rare side effects. I think that speaks well to the surveillance systems, some of which were built just for COVID vaccines. And I think, in medicine, we never say anything is 100%. We never say, I'm not going to tell you that there are zero side effects from the COVID vaccine, but obviously I got it. People need to put in context. Hundreds of thousands of Americans are dead right now from COVID. The life expectancy has dropped because of COVID. And in the African American community, it's been harder hit. And the age of people dying in the African American community is younger than in the white community. All speaking to some of these health disparities and how dangerous this virus is. This is not influenza. This is not normal. When you have about 700,000 Americans dead in the past since February or March of 2020. People who should not have died.
Yeah, context is extremely important, because that seems to be overlooked whenever someone, expresses a concern. And there's nothing wrong with having a concern. There's nothing wrong with even being fearful of it. But what's wrong is that letting that paralyze you to inaction.
Right. Exactly. I mean, 700,000 Americans are dead. The vaccine is so much safer than that. It's a very safe vaccine, no matter how you look at it, but especially in that context.
Yeah. So who should get the vaccine?
So right now, any American age 5 or over can get the vaccine and should get it. If you haven't gotten it already and you're 5 or older, if you're obviously the parent of a child who is at least 5 years of age, that child can get the vaccine. Any adult who hasn't gotten it yet should get it. I mean, as more and more people get it, I got my vaccine in December of 2020. As a healthcare worker, I was one of the first people eligible. I felt very privileged, I will admit. I felt sorry for people who wanted the vaccine and couldn't get it at that point. But, as more and more people have gotten vaccine, the safety is more and more evident. It was clear to me in December. I was excited. I was really, when the numbers came out and that vaccine was approved, the vaccines were approved or authorized in December, I think everybody was just amazed at how great they looked and how safe they were. And a lot of the concerns that people like me had before we had the data just didn't pan out. And as time has gone on, again, more and more people getting vaccinated, more and more time has passed. Really, the safety is well established. COVID is not gone. And I would like to also talk a little bit about natural immunity. There's a lot of discussion about.
Yes.
So we talk about natural immunity. And I did mention earlier that eventually enough people will be vaccinated or naturally immune that we should have smaller and smaller surges. I am hoping that inflection point will happen soon. But that is not to say that natural immunity is the same as vaccine immunity. Natural immunity is more variable. So it is still recommended, even if you had COVID, that you should get those 2 doses of vaccine just like anybody else, or 1 dose of Johnson & Johnson. That that it's not a good idea not to get vaccinated or to only get one of those doses. You need to be fully vaccinated. There's a lot of variability. So a few people who have natural immunity might not need vaccine, but there's no way to know who you are. We know the vaccine is extremely safe. We know that natural immunity is not as reliable. So a waiting period is okay. If you've just recovered from COVID, it's okay to wait 90 days, but get the vaccine after that. And there are lots of cautionary tales. There's more and more data about this. People have looked at people who have had natural immunity who did or did not get vaccine, and the vaccine does protect even people who had natural infection. The vaccine gives you an extra layer of protection against a new infection. That's been actually shown already. So it's natural immunity. It exists, but it's not a substitute for vaccination.
So can you explain the difference in terminology, or are they interchangeable, between natural immunity and herd immunity?
So when I say natural immunity, I'm not sure that that's a scientific term, but it means you got infected with COVID and you recovered. Herd immunity means some level of immune people in the whole population. So in the United States or Marion County, whatever population you want to look at, it means that there are enough people who have some kind of immunity, enough immunity that you will stop the spread of COVID. Mm-hmm. So we're unfortunately not there yet. There's so many new cases going around. It's obvious we're not there yet. Yeah. Very early in the pandemic, it was thought that if you could get 70% of people immune, whether immune from infection or immune from vaccine, that you would stop COVID. But Delta really changed that. Delta is more transmissible. It's twice as transmissible. Plus, we know that natural immunity is not as protective as vaccine immunity. So we're not really sure what percent of people need to be immune at this point to have herd immunity. It may be 95%, which is quite different than 70%.
Yeah, I heard that number had gone up. And so in short, people who argue, I've had COVID, so I don't need to get vaccinated, are barking up the wrong tree, so to speak. Again, explain that. If you've had COVID, and I've had family members that have told me, I've had it, so why do I need to go get the shot? I'm good.
Right. So I'm going to throw data at you. The CDC actually looked at people in Kentucky, one of our neighboring states. They looked at specifically at people who had COVID in 2020. And they looked at whether or not they got COVID again in 2021. So really very focused look at what happens in real life, not in a laboratory, not in a clinical trial. And in real life, those Kentuckians, all of whom had COVID and recovered, those who also got vaccinated were less likely to have a second case or to be hospitalized than the people who did not get vaccinated after their COVID. So again, very real life data. It's not, people want to be very absolute. They're taking very extreme positions saying, natural immunity versus no immunity, natural versus vaccine. There's a continuum. I am not in any way denying that natural immunity exists, that people get protection after they're infected. I'm not saying that at all, but I am saying that you should still get vaccinated because that natural immunity may not last that long. It's very variable. Some people have very robust natural immunity, some don't. And we don't have good ways of measuring that. We know the vaccine is safe. We know it seems to boost immunity even in people who've been sick with COVID and recovered. So why not just get vaccine?
Yeah. So how soon, if you've had COVID, how soon can you get vaccinated, and how soon should you get vaccinated once you've had COVID?
Right. So you should certainly be recovered. You should be feeling better.
Okay.
Right. You don't get vaccine while you're still coughing or still having fever.
Okay.
On that, CDC doesn't give guidance. I think it's prudent to wait 90 days. You'll probably still have an immune response 90 days out. And that just gives you gives your body a chance to settle down. And it's probably safe to wait 90 days. But just to be clear, that's what I personally would do. CDC does not say you have to wait 90 days. So if you wanted to get vaccinated sooner and you're recovered and feeling okay, you could do that.
I had another family member who had it and wrestled with it quite a bit, was never hospitalized, but just felt horrible, and was saying that as soon as he recovered, he wanted to go get the vaccine, and his doctor told him, just wait. He waited 60. He didn't wait the full 90 because he said, I figured 30 days. And he did his own doctoring or whatever. Is that an issue of people that want to get it sooner because they don't ever want to feel that way again? So he did his, I think it's 64 days, not 90.
That's completely fine.
Okay.
CDC initially said wait 90 days, then they backed off. They felt that was not necessary. You're probably okay waiting 90 days. I would probably myself get it soon after that, but what your relative did was fine.
Yeah, what he did. So let's get back to the most recent group to join the party, so to speak, the 5 to 11-year-olds. What is the guidance for that? I understand that a third of parents are hesitant to give their children this vaccination, even though, as you say, it's been declared safe. So talk me through that. How does that work? Do they still get 2 shots or do they get 1? Do they get a full dose, quarter dose, 3? How does all of that work for kids? And what can you say to parents to reassure them that it's okay to get a 5-year-old a COVID-19 vaccination?
Right. So the only COVID vaccine that 5 to 11-year-olds can get is the Pfizer. Okay. And it is a reduced dose. It's 1/3 of the adult dose. And they picked that dose. That was the dose that was studied. Kids have very strong immune responses. So the thought was that they didn't need the full amount of vaccine that an adult would. They also wanted to minimize side effects in children, again, because their immune systems are so strong. It is 2 doses of the Pfizer vaccine. It did protect the kids, and there were no serious adverse side effects. One of the concerns, and I think you were going to come to this, is the myocarditis issue.
Yes. Okay, go ahead.
So, I know people don't like or trust government, but the FDA is very serious about safety. And one of the concerns that has so far not panned out is this myocarditis or heart inflammation. It was seen very rarely, but it was seen in young adults who got the vaccines. So when the FDA, and the drug companies wanted to study this in children, there was concern about this, and that's one of the reasons the kids get a reduced dose. The other being that even at that lower dose, they do get that immune response. And I think, like with all things, context is really important. So CDC and FDA have really looked very closely at myocarditis after the vaccine. They also looked at myocarditis after COVID. So basically, myocarditis in general has increased since COVID hit the United States, not necessarily related to the vaccine. So COVID itself causes myocarditis. COVID itself is more likely to cause myocarditis than the vaccine.
Okay. Have any of these cases that were studied where it was discovered after the vaccination that myocarditis and or heart inflammation, were any of the cases fatal?
I'm going to punt on that, Tina. I don't want to say it's 0. I think the myocarditis cases in general after the vaccine. Well, I know this. I don't want to talk about how many people died or didn't because I don't know an exact number. But the myocarditis heart inflammation cases after vaccine tend to be more mild than other heart inflammation cases. Very few people ended up in intensive care units, people who were hospitalized in general. Again, I can't say 100% because that's in medicine, we never say 100%. They were generally hospitalized for a day or two and then sent home. And the vast majority of the young adults who were identified as getting heart inflammation have seemed to recover. And again, putting that in context of all the people who've died of COVID itself or got more serious heart inflammation from COVID itself.
And so, can you summarize what you just said? I know you just said it, but can you repeat that and then kind of summarize it? Because I have another question regarding myocarditis.
Right. So sorry, myocarditis or heart
Myocarditis,
inflammation.
Heart inflammation. Yes, go ahead.
Is a rare side effect of the Pfizer and Moderna vaccines. It's more common in young adults, but again, common being relative because it's still rare. Most of the people who had this side effect recovered and had relatively mild heart inflammation. And it's also known that COVID itself causes heart inflammation and that your risk of getting heart inflammation from COVID itself is much greater than the risk of getting heart inflammation from the vaccine.
Wonderful. Now, is myocarditis reversible? I mean, is it something once you have it for the rest of your life? I mean, can it be treated? Does the inflammation, I guess, for lack of a better phrase, eventually go down, or does it remain inflamed throughout your life?
There's variability here. Again, nothing is 100%. Most of the people who got the heart inflammation after the vaccine seem to have recovered. This is not the end of the story. I mean, FDA and CDC are still following people out to understand this better.
So the next group to get the vaccine, it's the only group left. I guess it would be infants, 6 months to 5 years? Is that something we're looking at coming right around the corner in the next few months, or next year, or is that going to be a while before we add that group?
I don't have a time frame. I don't know how far advanced the clinical trials are. I do think people will be watching closely the 5 and 11-year-olds. But again, and I've said this before, the 5 and 11-year-olds are getting a reduced dose of the vaccine. And they did have benefit. I mean, the vaccine was beneficial in that group.
In addition to the safety that you've so beautifully outlined, why is it so important, especially important, to get our children in these age groups from 5 to 11, 12 to 16, or 12 to 18? Why is it so important to get them vaccinated?
Right. So children have really suffered from the pandemic on many levels, and not just directly from being sick, although many children have been hospitalized. And between October of 2020 and October of 2021, 66 children in that age group, 5 to 11, actually died of COVID. So again, this is not like all or nothing here. We talk about how COVID is worse for older people than younger, and that's true. It is not safe for younger people by any means. In addition to those direct effects of COVID, and in addition to the multi-inflammatory syndrome that children can get from COVID, children have lost a lot of school. Children were not in classes. They were not with their peers. They were suffering obesity and depression. And a lot of them lost school and education time. There are gaps in education. And this is another situation where the African-American community is disproportionately affected because of socioeconomic status. There's already an education gap between people with lower and higher socioeconomic status. And that has been worsened because of COVID and because most kids were not in classes, right? They were remotely learning for a year. Mm-hmm. Well, think about broadband and how difficult it is if you're working or if you're not able to be home with your children while they're trying to be at school, right? If you have a job that lets you work at home and you have broadband and you're in that privileged status because of your socioeconomic status, you can better supervise your child and give resources to your child while they're struggling remotely.
Yeah.
And so even though mental illness and depression and obesity have really hit 5 to 11-year-olds hard because of COVID, not because of COVID itself, but because of all those downstream effects. It's worse where you already have an education gap and maybe you don't have broadband and you have a small house and lots of people in the house and you don't have space for that remote learning or reliable broadband, or you can't be at home to supervise your kids, or you have to quit your job to supervise your kids. So then you don't have enough resources or money to pay for basic things. Think about all that downstream stuff and all the school that kids have lost. And when schools reopen, every physician, every pediatrician, every child advocate in this country wanted schools to reopen this fall. But when that happened, COVID surged and a lot of schools had to close again because of COVID. So just think about all that in addition to the direct effects of COVID itself. It's just so important that kids get vaccinated to keep them in school, to keep them safe in school, and all that.
So is it safe to send the children back to school?
I said mine.
Pardon? Yeah.
I mean,
yours are vaccinated though.
I'm vaccinated, and my son is vaccinated. My daughter's vaccinated. They are back in school wearing masks, but they are back in school. They are not 5 to 11. They're older.
Okay.
But yes, I mean, safety is relative, and just like you wear layers to keep warm in cold weather, there are layers of protection. So before we had vaccines for 5 and 11-year-olds, masks were one of the ways that we layered protection on our kids. Not going to school sick is a way to layer protection on our kids. Having some distancing, having teachers vaccinated, all these are ways to layer protection on kids. And now vaccines will add another layer of protection for the kids themselves.
And back to the vaccines, I know we're running short, so I want to get a couple more questions in, but are the side effects in children, be it 5 to 11 or older, all the way up to age 18, are they similar to the ones that we as adults suffered when we were vaccinated? I won't say suffered, that we encountered. I'll say it was an encounter,
right.
Because my reaction was rather brief. It was intense, but it was rather brief. I think 12 hours, and then I fell asleep, and right. Boom, I'm fine. So what if we do get our children vaccinated? What can we expect, or is there a different set of side effects to look for in kids?
The side effects seem really similar. The sore arm, the myalgias, then the muscle aches, the fatigue, maybe low-grade fevers, but very, very similar to the adults.
Yeah. Okay, and another question. This one got pretty big not too long ago, and we are talking about current. What about the mixing? You got J&J, you got Moderna, you've got Pfizer. Those who are already vaccinated, who want to get boosted. What's the latest on the mixing thing? Because I mixed mine.
And mixing is fine.
I mixed mine. Yeah.
It's like with flu vaccine. We don't worry about what flu vaccine we got last year. We just get whatever we get. But to better answer your question, first of all, boosters are only for adults. They are not for children.
Good point.
Only adults get boosted.
And that age 18 and up?
Correct. And then there's a very complicated schema that's hard to explain without visual aids. So if you got Johnson & Johnson, definitely, absolutely get boosted. Johnson & Johnson has a very durable immune response, but it's a lower level than the other vaccines.
Okay.
So absolutely, positively get boosted.
Okay, that's what I did. I got Johnson & Johnson in March.
And mix and matching is fine.
Okay.
So it doesn't matter what, if you got Johnson & Johnson or if you got Pfizer or Moderna to start with, when you're talking about boosters, whatever you want, whatever's available, that's fine. And, different people may have different reasons for wanting one vaccine or another. If you're age, so getting back to who should get boosted. So Johnson & Johnson, absolutely. Age 65 and above, yes, absolutely, strongly recommended. We know people who are age 65 and above, their immune system responses seem to be tapering off more than other people in the population. Pretty good data for that. If you're age 50 and you have one of the medical conditions, and there are many that put you at increased risk of severe COVID, absolutely, positively. If you're anybody else 18 and above, you are certainly permitted and allowed to get a booster, and it starts getting more to be personal preference. You are not in any way prohibited from getting a booster, and their CDC is asking people to do some heavy lifting in considering their own risk. So you may be a healthy 40-year-old, but maybe you have somebody in your household who is immunosuppressed or an infant, and you want to be absolutely certain that you're protecting that person, or you work in a grocery store, or you're an ambulance driver, or you work in a school, and you have a high exposure to people who might have COVID. If they're asking people to really think about their own situations, but the bottom line is you are permitted to get a booster. You should wait 6 months after your last dose, and that's more to do with making sure the booster works. If you just think about it, if I just got my vaccine a week ago, boosting isn't going to work for me, because your immune system has to have a certain amount of maturity, for lack of a better word, for that booster to work. So 6 months after your last COVID vaccine, if you got the Pfizer or Moderna, that's the right time to boost. For Johnson & Johnson, 2 months is the right time. You really should get that 2-month booster, because we know Johnson & Johnson levels out at a lower level if you only get 1 dose. If you have another minute, can I add another piece of information? Because I know it's so complicated.
Yeah, because I have a final question about that. Very quickly. I'm going to ask it right now while we're on it, because it'll fly out of my head. So say, for instance, if you boosted, okay, you like with me, the J&J, and I boosted with another one, Moderna, okay? Should I mean, basically, it was way more than 2 months since I got the shot. So should I finish the series, if you will? Or just 1 dose will do it, even though I'm way down the road from my first vaccination and get 1. So what should people do? Should they finish the series? And if they do mix it, like if you had J&J and then you get Moderna, should you go back and get the second shot a month later to complete it?
The booster is a booster. It's a single booster. Now, a year from now, who knows? But right now, it's only 1 booster, and it doesn't matter what you started with.
And and is the booster the same dosage?
Right.
Same dosage as the regular?
So again, without like a pie chart, like I feel like I need a chart in front of me.
Okay. Here's your chart. Go ahead.
Yes. So we talk about a primary vaccine series, right? So a primary vaccine series is either 1 dose of Johnson & Johnson, 2 of Moderna, 2 of Pfizer.
Okay.
And that should hopefully be the same. So 2 Pfizers, 2 Modernas, 1 Johnson & Johnson. Then you get a booster. The booster, your choice. It's either a full dose of Johnson & Johnson, a full dose of Pfizer, or a half dose of Moderna. And remember, Moderna already, there's more in it than the Pfizer. And that's it. And again, timing, can't be easy. The timing of the booster is 2 months after Johnson & Johnson or 6 months after your second dose of Pfizer or Moderna. Now, just to make things a little more complicated, because it's not complicated enough.
Okay, here we go.
If you are an immunocompromised person, immunocompromised like in an organ transplant, a bone marrow transplant, you're on injectable medicines for rheumatoid arthritis, like real heavy level immunocompromise, which is only 3% of the population, then your primary vaccine series is a little bit different. For Johnson & Johnson, it's the same, but for Pfizer and Moderna, you actually get 3 doses instead of 2. And in that very, very narrow situation, that's true for 12 to 18 as well as adults. And then after that, so you get your 3-dose primary series of Pfizer or Moderna, then you still can get a booster 6 months later. Johnson & Johnson, there's not a difference. It's still, you get the one Johnson & Johnson, and then 2 months or more later, you get your booster. You're fine waiting longer for your booster. So you're fine having waited longer than 2 months, because you probably got Johnson & Johnson as soon as it was available, I would guess.
Did. Yeah, the second or third day. Yeah.
Absolutely. Boosters require that your immune system have had a really good response to the first vaccine, and that's kind of matured. So longer is fine. You just don't want to get your boost too early because it won't be as effective.
I got you. I see. Now, back to your point that you needed the other chart for.
Yes, like so complicated right now.
I hate to ask this, but I hear it all the time on my show. And a lot of people, they've self-diagnosed and they say, well, I've got a condition. And because I have a condition, I shouldn't get the vaccination. I'm scared of getting the vaccination. So is there anyone or any particular group? I know you said there's a small, a minute percentage, and it brought me in mind of a recent, the death of Colin Powell, who was extremely compromised. And, like you were saying, 3 dose, he was about to get his 3rd dose, but it just wasn't effective because of the fact that he was so compromised. Is there anybody or any particular group that you can think of that should stay away from the vaccine altogether?
I really can't. I mean, there are some real subtleties here. Like if you're getting a bone marrow transplant, right? You need to wait until that transplant has established itself. Otherwise, the vaccine is not going to work. But that's not a don't get it. That's a wait until your body can respond. And that's something that you need to talk to your own doctor about. Some people on really heavy immunosuppressive medicine may need to time their vaccines around that medicine in consultation with their physician. There are very, very limited contraindications. So some, very early on, there were reports of people having, allergic reactions to the vaccines. So if you actually had that allergic reaction, you would not want to get the same vaccine. Mm-hmm. You could get a different type under medical supervision. So if you had an immediate allergic reaction to Pfizer or Moderna, you might be able to get Johnson & Johnson under observation, or vice versa. Also, if you know for a fact that you had a reaction to one of the components of the vaccine, that would be a reason not to get that particular vaccine, but you might be able to get one of the others. But there's a little bit of subtlety here. If you had, most people who've had reactions to, say, flu or MMR they will be fine getting the COVID vaccine. So if you say, I had an allergy to influenza vaccine, or I had an allergy to the measles vaccine, that is not an absolute reason not to get the COVID vaccine. What it does mean is when you get it, you should be watched for 30 minutes, but it doesn't mean don't get it at all. Yeah.
And that's the protocol when you get it anyway. I mean, it's not 30, it's 15, but you always have to go to the sitting area. So where do you think we'll be with vaccines? Maybe, I know you say, I know, I can't predict, but vaccines 6 months from now, do you think that there may be another option in the next 6 months, like an AstraZeneca or another drug coming on board to give you a 4th choice of a vaccination?
Yeah, there's some interesting things coming out. I'm not really sure about the status of AstraZeneca in the US, but there is another vaccine made by Novavax. So Novavax is a completely different platform. It's different than Johnson & Johnson's platform. It's different than the mRNA platforms. It's similar to Shingrix, one of the shingles vaccines. So it's a completely different platform for people who maybe are uncomfortable with one of the platforms that currently exists. It may have different side effect profiles, different allergy information, different components. So people who want a different technology, I I'm not telling people to wait for Novavax. I do think that that COVID is severe enough and common enough that there's really no reason to wait, but it's going to offer another option. And I do think that will eventually be approved in the US. Again, FDA will say, but I think it will be available.
Yeah. And finally, in keeping our conversation current, I want to know what your thoughts are on this COVID pill that has been emerging. And it seems, doctor, that people are more excited about taking a pill after they get COVID than they are about getting the vaccination to keep them from getting COVID. It makes no sense, but
Yeah,
be that as it may, the COVID pill.
Yeah, there are two. So Merck and Pfizer both have COVID pills. They work different ways. They both seem very effective, but these pills have side effects. So I just find it, I find it ironic that people are excited about a pill that is trying to treat a problem instead of prevent a problem. The pills are not 100% effective. They're highly effective, but again, not 100%. I think the vaccine is more effective. And so I won't say one shot deal. It's a 2 to 4 shot deal, I should say. But still, the vaccine lasts a long time and it's really effective and very safe. So I think it's great we have other options and we have pills. And there are people who, because they're very, very immunosuppressed, like Colin Powell, right? We need pills for people like him.
Yes.
But it should not be seen as a vaccine substitute. And these pills have side effects. So we need options for everybody. I still think vaccines are the way to go.
And with that, we will leave it right there because that's where we started. Vaccines are the way to go. We're not in danger in this country of running out of the supply or anything. So if we had a mad dash today, we could still handle it for people getting their first time
Right.
shots. Yeah. And there's no, in terms of J&J, Moderna, or Pfizer, if people are getting vaccinated for the first time, no real difference, just like you were saying, the subtleties to discuss with your healthcare professional?
There are subtleties between the different vaccines. I would say that, we have more data about this. So if you're a woman under the age of 50, you might be better off with Pfizer or Moderna because of one of the very rare side effects of the Johnson & Johnson vaccine. This was a side effect that was so rare, it was not picked up until the vaccine had been given to people. But other than that, I really think they're all good vaccines. So again, the vaccine can't work if you don't get it. So
in short, get the vaccine, get vaccinated, please. Save lives and save others. Dr. Amy Kressel, Medical Director of Infection Prevention and Antimicrobial Stewardship at Eskenazi Health. And you can find out more at eskenazihealth.edu. Is that correct?
Yes.
Okay. And people can find you at eskenazihealth.edu, correct?
Yeah. Yes.
All right. Thank you so much, Doctor. We appreciate you joining us today.
Thank you.